and I'm going to fill it all the way to the full 3 cc's. Great. And now at this point, I just tap, 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 get it all up there. I'm going to replace the cap, take this off, another tap, tap, tap. I'm not afraid of losing any of this material because I have a huge dilution, and most of it that comes to the top is actually methyl cellulose. I really don't have much in there, but now there's a bubble, and bubble is gone. Great, now I know that I have only the material, so I can put a 25 gauge needle, which is 1.5 inch long. This is made by BD. Okay, make sure it's tight enough. And then again, I have to make sure that this is not empty, it's been primed. Very essential to make sure it's primed. And now just with 1, 2, 3, 4, make sure there's enough, and there's an easy flow coming. Now I'm ready to go. So I grab this in my hand. Usually I have an assistant, but Jane is going to be my assistant. Okay.
You leave all this on stuff?
Yeah, I leave this on. So this is Z-cane. This is different than amla. So this is colorless, and it actually, if it stays on, doesn't matter. And I had her wash her face aggressively with the facial wash after washing her hands, so I know that she's perfectly clean. And usually I try to go first right underneath here into the tear trough, because the infraorbital nerve is here as well. So once I go through this area, that's going to start numbing very fast, and then she'll feel relaxed. And once I do that, then I go to the other areas, and I do it slowly and gradually. Okay. And I'm under the orbicularis oculi muscle. And there we go, coming in over here. And I can redirect my needle. I'm still deep, I'm not superficial at all. I don't want to be superficial. I'll go down here. I'm right around here in this area, coming down. And I'm done with this area. Now I'm going to have Jane hold this with pressure. Again, I'm going to move your hand a little this way. So you spread your fingers there. Good. Great. How are we doing? Mm-hmm means good or bad?
Good.
Okay. Okay, great. So now I'm having Jane hold it with pressure, because that is, in my opinion, very, very important. And if you keep the pressure long enough, you're very unlikely to bruise. And you don't have to be gentle with this pressure. So she's holding it for me, and I'm getting ready for the other side. Now there's some foam. This is very important. I want to see this foam right here. And so this is going into the top. It's gone to the top. It's going to be out of my way. This is useless foam methyl cellulose. So I'm going to go right again in the red stopper between the two parts so I can see my needle. Okay. Now I'm getting it from there, and I'm getting very little methyl cellulose. It's coming all the way down. I'm getting the full 3 cc's. Great. Okay. Jen, how are we doing?
Good.
Good. Okay, I got the extra foam out. Then we do it again, look through the whole syringe. You can see that there's nothing in the column. I wish there was, so I can show how tapping brings it to the top, and then you can kind of shake it out. There you go, there's just like one bubble, and now it's all primed. We get it, and we prime the needle again to make sure that, there you go, 1, 2, good. So this is flowing very well. Now we'll go to the other side. And we do exactly the same thing on this side as well. Excellent. If you notice, I applied the pressure immediately in the area where I saw that maybe there was a tiny bit of blood oozing, because that will stop it from spreading. Good. And without taking it off, I'm going to have Jane hold it with her hands. Good. Jane, how are we doing?
Good.
Excellent. Now, if I had the assistant with me, I would have the assistant hold it, and then I would go on to the other areas. But since I don't have, I'm going to have her hold it for about 3 minutes by the wash to make sure that we have good pressure. And then I'm going to resume the injections in the other areas in 3 minutes. And then I'll demonstrate the other areas as well. Okay, so I'm filling it again, and as you can see now the volume is going down slowly and gradually. I enter again, and when I'm turning it upside down, the foam is on the top, and that's great. It's out of my way. And I'm getting about 2 cc's out because that's what I need for the right side now. And I got it. Okay, and at this point I'm switching the needle to a new needle because even without any trauma, the needles can get blunt pretty fast. I just shake it. You can see the drops flying out. Don't worry about it. That's good. Getting all that cellulose out and getting all the little bubbles to coalesce into one big bubble and bringing it out. See the bubble? Beautiful bubble. There you go. One more bubble. There you go. Now it's a good flow. So now I can put it on, and now I can prime my needle. 1, 2, 3. Good. So we are primed. And now we'll go on to the right side. Jane, you can take the right hand down now. Great. And I'll let you hold this. There you go. There you go. Perfect. I'm going to turn you around this way. And I'm starting with this jawline that I'd marked. I'm going in under the skin, subcutaneous, and I'm just gently filling it up right here. Perfect. This is done. And now I'm going to go into the marionette chin triangle. I'm going to bother you again to hold pressure right there. Good. Almost like you're squeezing your chin, so use your thumb as well. You're squeezing this. Perfect. Thank you. Thank you. And I'm just going to hold pressure a little bit here for just a minute. When we were actually off the camera for a second, Jane told me that she forgot to stop her aspirin. She takes an aspirin, and you can see that despite that, she really doesn't have any bruising here. And that's, partly because of the pressure, partly because she's calm and relaxed. So I've had those incidents, and in those cases, what I do is I tell the patient, please take the day easy. No activities during the day like working out or running around all over the place. If you can just relax and ice as much as you can, that'll help. One thing which is a big no-no is workout. A lot of patients come on days when they're off, and they try to combine everything into one. Dentist appointment, gym, coming to meet, and not a good idea. Especially when you work out, it is good for your health, but now you've got vasodilation going on all over with a little bit of increased baseline heart rate and increased blood pressure as well. Those are set up for increasing the bruising because your circulation is really pumping. So that day, you really should not be doing any workout. Okay, as we get near to the end, we have a little bit of more foam collected here, and I'm going to use all the rest for the left side now. So with the gap between the red rubber stop, I can see what's going on. I can see my needle tip, and I can start withdrawing to see how much I have. One of the reasons I mark what I'm going to inject is because you can end up running out of material when you get to the last area you're going to inject, and that can be very troublesome. Great. So I got it all. You can see this is all foam in there. This is useless. Don't worry about it. This is not material that you're losing. I'd rather not have it at all in the patient, and there you go. So now I have what I need for the other side, and it's exactly 2 cc's. Okay, we did a tap tap, getting the air bubble out. Good. Easy flow. Sometimes when the material comes out, it can be slippery, so be careful. If that happens, that you feel like a syringe is getting slippery from the material flowing over, dry it up quickly because you don't want to have a slippery syringe in your hands. Okay, when that's done, you prime the needle again every time. Good. Nice flow, and now we can go to the other side. Jane, you can take this down in your hand. There you go. Very good. I'm going to turn you around a little this way. Very good. We'll start with the angle here.